So to continue talking about the lung-kidney interaction in disease in clinical practice, let me now talk about, shift to another presentation. This is my fourth presentation, the fourth mini lecture on this topic, lung-kidney interaction in clinical practice. And I will focus in this presentation, the fourth presentation, on the lung or pulmonary complications of renal disease. Pulmonary complications of renal disease. In the previous ones, I was talking about the renal complications of pulmonary disease. Now I will talk about the pulmonary complications of renal disease. And to be more concise and to the point, let me talk about what are the pulmonary complications of chronic renal failure. In patients with chronic renal failure, we have a wide range of course, of pulmonary complications, which can be summarized under two main topics: restrictive lung disease, which is a common defect. Because we all know that lung defects are either ventilatory defect, which might be obstructive or restrictive, what we call obstructive hypoventilation and restrictive hypoventilation. So ventilatory defect, number one. Number two may be diffusion defect, as exemplified by the interstitial lung disease, or perfusion defect, as exemplified by pulmonary hypertension and pulmonary embolism. Especially the moderate and massive pulmonary embolism cause perfusion defect because they affect the pulmonary arterial circulation. So the lung defects pathologically broadly classified into diffusion defect, ventilation defect, and perfusion defect. And I give the most common example of diffusion defect, interstitial lung disease category. Ventilation defect, the obstructive hypoventilation defect or ventilation defect by the chronic obstructive airway diseases. And then the perfusion defect by pulmonary hypertension, which is another important issue, which might also affect the kidney pathologically, directly and indirectly. Cases of pulmonary hypertension, whether primary pulmonary hypertension or secondary pulmonary hypertension, which is a pulmonary vascular disease causing perfusion defect. Let me go again to the kidney. How does patients with chronic kidney disease and with advanced chronic kidney disease, especially phase 4 and 5 chronic kidney disease with glomerular filtration rate less than 30 milliliter per 24 hours as creatinine clearance or glomerular filtration rate. In such patients with chronic kidney disease, we might get common pulmonary complications. The commonest are pulmonary edema, of course, due to volume overload. There is pulmonary calcification. We might get also some sort of pleurisy, pleural effusion, fibrinous pleuritis, and also recurrent infections or recurrent pneumonias due to immunocompromised system in patients with chronic kidney disease causing immunodeficiency. Of course, chronic kidney disease is one of the causes of immune deficiency by many mechanisms. So this immune deficiency will make the patient susceptible to infections. And one of the common systemic infections is pneumonias. So pneumonias might be a complication of chronic renal failure, recurrent pneumonias, due to immunocompromised status of the patient. And especially if the patient has other comorbid conditions, like, for example, diabetes, which causes diabetic nephropathy and chronic kidney disease, being a common systemic disease causing chronic kidney disease, the diabetes mellitus. So diabetic nephropathies are comorbid conditions which might make the lung more susceptible to pathology and to complications, other comorbid conditions with the chronic kidney disease. So whether the kidney disease is due to intrinsic renal disease or systemic pathology, like in diabetes, in amyloidosis, in systemic lupus erythematosus, which are common three systemic causes of chronic kidney disease: diabetes, lupus, amyloid. In addition, of course, to other diseases which might put the kidney of the patient at risk at the risk of chronic kidney disease. So pneumonia is a common complication of chronic renal failure. As I mentioned, pulmonary edema due to volume overload, pleural effusions, fibrinous pleurisy. These are all renal complications. Also, in patients with nephrotic syndrome, we might get hypercoagulability and pulmonary thromboembolism in some reported cases due to hypercoagulability, which is a recognized complication of nephrotic syndrome. These are all related also to the volume overload and also to the metabolic acidosis. Metabolic acidosis associated with chronic renal failure. They might also cause respiratory compromise, most commonly disturbances in the function of the lung with the classic Cosmos breathing, rapid deep breathing observed in metabolic acidosis, which is a complication of chronic renal failure. The hypertension which associated with chronic renal disease, they might cause hypertensive heart disease and cardiovascular or heart failure and cardiovascular complications due to hypertension complicating chronic renal disease. As I mentioned, the hypercoagulability associated with nephrotic syndrome, they might cause pulmonary thromboembolic manifestations. This is the range of possible pulmonary complications of chronic kidney disease with chronic renal failure: the pulmonary edema, the pleural effusions, the effects of metabolic acidosis, the effects on the pulmonary vasculature, especially in hypercoagulability state complicating nephrotic syndrome. Also in patients with acute glomerulonephritis and acute nephritic syndrome, with oliguria and hypervolemia, they might also be complicated by pulmonary edema due to volume overload. So this also might be a complication of acute nephritic syndrome complicating acute glomerulonephritis. Also pleural effusions in such cases. So these are also complications or acute pulmonary complications complicating acute renal injury, as what happens in patients with acute nephritic syndrome due to acute glomerulonephritis. Same also in acute tubular necrosis. Possible pulmonary complications also due to the oliguria in such cases and the volume overload. This also might be, on the long term, be complicated by another pathology, which is pulmonary calcification, for example. So edema, calcification, effusions, pulmonary vascular complications are all possible manifestations of both acute and chronic kidney disease of whatever underlying pathology involved, whether due to intrinsic renal pathology or the kidney being involved as a part of systemic disease, that is extrinsic factors affecting the kidney functions. Thank you so much, and let me proceed to talk about another, my fifth presentation will be in the coming broadcast, inshallah. Thank you so much and have a nice day.